State Senator Samara Brooke. And now please welcome the 57th Governor of the great state of New York, Governor Kathy Hochul.
Good afternoon. Today I'm taking on an issue that no other governor in the entire state of New York, 56 before me, going back to the year 1777, is able to speak with the authority that I can. I'm talking about the perils of pregnancy and the real impacts on women's health, physical and mental health. And I will say, as the first woman governor of this state, America's infant and maternal mortality rates are horrific. They're a disgrace. And last week, news came out that shook me to my core. The New York Times reported that in 2022, the infant mortality rate, which we've been talking about for a long time, instead of going down, it actually rose. It rose 3%. The sad truth is we have a health care crisis on our hands, and not just when it comes to the babies, but their moms as well. And New York must stand up and be a leader and take action to stop this. I want to thank the leaders who've joined us here today. Senator Brooke, thank you for being a champion on this issue. I'll be hearing from her in a couple minutes. Thank you, thank you, thank you. I also want to thank Assemblymember Szilagyi for her support championing this through the State Assembly. We also have Shannon Johns, the founder of Calming Nature Doula Service and Center. Thank you for joining us all the way from Erie County. All right, that's great. And Chanel Portia Albert, the founder and executive director of the Ancient Song Doula Services, as well as Antonio Reynoso from Brooklyn. Thank you for being here today to help support this. So I think it's pretty well known that I'm not just the first woman, I'm also the first mom governor. And raising my two children ranks up there with some of the greatest challenges, but certainly the most rewarding experiences I've had in my life. I think they turned out okay. But what for some is a joyful experience, for others it starts out in a really challenging, hard way. It comes down to whether you have support. Do you have people who understand? People literally hold your hand and be your advocate and champion for you. And I'm not just talking about from family and friends, but also from healthcare professionals who understand. And I am so focused on the well-being of moms and babies before, during, and after childbirth. But here, with women dying at a higher rate during childbirth than in other wealthy, developed nations around the world, why would we be among the last? We should be the first. We should be there should be a statistic that we're proud of. We're double the rate of our peer countries in terms of both infant and maternal mortality. And like many other injustices, race certainly is a factor. Black babies are 2.5 times more likely to die than white babies. Black women are 3 to 4 times more likely to die in childbirth. That's not acceptable. That's wrong. It's unconscionable. No woman of color, and I've heard them talk about this, should fear starting a family and getting pregnant because they don't know if that's going to be a death sentence for them. Have we really come to that in this great country and here in the state of New York? It doesn't have to be this way. Most of these are preventable. And to have this state of affairs in the 21st century is not only shameful, it has wider implications because women and babies who don't get the care they need, they suffer. Communities suffer. Our entire state suffers. We have been focused on this. We are starting to see in our own state more promising results. Back in 2010, we were 46 in the nation when it came down to maternal mortality. The most recent rating, we're at 15%. That's progress. But is anybody satisfied with that? No, not here in the state of New York. And we're currently ranked 4th for the lowest infant mortality rates. But no baby should have to die unnecessarily. So we still have more work to do to expand high-quality health care. So I'm here to talk about some of the latest updates on our work to take on the maternal and infant mortality crisis. Perinatal care has many different elements, different stages, and some of the people who are out there through every phase of it are the doulas. We've got a lot of doulas in this room today. Raise your hand. All right, the doula convention. As I mentioned, ancient song and calming nature, I want to thank you for joining us here today to represent thousands of doulas from across the state. And those of you who are wondering, what is a doula? Here's your little tutorial. They're part of the birthing team along with doctors and midwives, but the team doesn't just start at delivery. These are experts who provide physical, emotional, and information support. They're the advocates, they're the champions who stand up and question a decision that someone else may not be in a condition to or have the understanding to do. So they bring their experience, their knowledge to bear with every single client, their patient they take on. So it typically starts a few months into the pregnancy, continues into postpartum care because, as we know, it's also a really hard time for moms too, and a lot of people don't talk about it. They don't understand it, and it's perfectly natural, but you still need some help. They advocate for women's needs during the delivery process, but also making sure that that care is tailored and it's appropriate for the individual woman. No one size fits all here. We take care of the individual. And also helps reduce the impact of the racial bias on pregnant people of color. Now, there's a growing body of research that shows doula care is related to reduced C-sections, premature deliveries, reduced likelihood of postpartum depression. So they have a vital role to play, and they're being successful. And they create real benefits for their patients. And not only are a lot of New Yorkers not familiar with the services they provide, they have no idea how to find one, right? Unless you walk in this room, you're probably not going to find one very easily. But we can solve that. It's not complicated. So we're going to make doula care as accessible to as many New Yorkers as possible in communities where they're needed the most. So I'm pleased to announce that in a few minutes I'll be signing a bill that'll help create the New York State Doula Directory to connect New Yorkers with licensed doulas. And I want to again thank our champions in the front row. Let's give them a huge round of applause. Senator Brooke and Assemblymember Solage for sponsoring this legislation. It'll be easier to find them. It'll ultimately reduce barriers to getting good quality maternal care, infant care, and helping these areas where we're trying to fight and drive down the mortality rates. But also, you may find a doula, but some are going to say, well, how do I afford this extra coverage? How do I afford this? Is this something I can pay for? And for too long, these services were not covered by our health care providers, including Medicaid. They just didn't cover it. That's not going to happen any longer. Today I'm announcing that doula coverage will be available to all Medicaid enrollees in New York State starting January 1. And we're able to do so because of changes we pushed in last year's budget. I've only had 2 budgets to work on, but this was one of my priorities to make sure that we have access and affordability for families. So we've extended the postpartum Medicaid coverage from 60 days to 12 months. Okay, who would think you're fine after 60 days? I've been there. You're not feeling great after 60 days. So we extend the coverage for an entire year and expanded it to cover critical services for new moms and reimbursement for midwives and doulas. So finally, we know how hard it is, how critical it is to make sure that they recognize, that doctors and hospitals recognize the unique challenges facing parents and newborns. Here in New York, we have 17 regional perinatal centers across the state. The amazing work they do for moms and babies, including the NICUs. Last year, I pushed for record funding to support them to make sure they can continue their urgent work. And it's so important, especially when these rates of mortality are rising. So we're announcing today that the $4.5 million that we allocated in the budget is out there in all these regional perinatal centers to do this extraordinary work. So that money is out there in our community. Let me close with this. as a mom and a new grandma. My grandbaby, makes me feel really old, is the same age as Senator Brooks' little daughter, Leah, 18 months old. 18 months is a real challenge, isn't it? I don't know how you do it, girl. I don't know. But here's our commitment. We're not going to lose any mother or any baby because of the color of their skin. We're not going to do that anymore. We're going to treat everyone equally. Racial disparities exist in every facet of life, in education, in housing, in healthcare, in employment. Well, let's leave here committed with the belief that everyone deserves a healthy start from the very, very first breath, and that they can be free from the racism that has taken the lives of too many moms and babies for too long. It ends now. It ends on our watch because that is an injustice in its purest form, and I won't tolerate it. So we will right the wrongs of the past and ensure that every mom and baby gets a first-rate care, support from doulas, a state that understands their challenges, and finally eradicate this insidious form of racism which has plagued our state for far too long. That is what we're going to do, and it is now my pleasure to introduce someone who's been an amazing champion, our senator from upstate New York. Nothing wrong with upstate New York, right, Senator? Samara Brooke.
Thank you so much, Governor Hochul. It's so wonderful to be here with all of you this afternoon. And I just want to start again with a sincere thanks to Governor Hochul. Boy, do we notice a difference when we have a woman and a mother in a position like the governor of New York State. So thank you for seeing the value that doulas have had both for my life and so many of our lives. And as the governor said, the fact is we continue to face a maternal mortality crisis. And in so many ways, this crisis is actually getting worse. In fact, in 2020 alone, maternal mortality rose by 14% nationwide. And as you heard the governor describe, Black women and brown birthing people are usually at the brunt of this crisis. Here in New York State, which we will change starting today, but here in New York State, Black women are 5 times more likely to die in childbirth than their counterparts. But perhaps the most troubling piece of this crisis is that according to our own Department of Health, 78% of these deaths are preventable. And nearly half were directly linked to racism and discrimination. Doulas, and particularly our community doulas, do play a crucial role in disrupting some of these key contributors to maternal mortality. Community doulas, as the governor pointed out, have shown to improve maternal health outcomes, reducing the rate of cesarean sections by 50%, reducing the time of labor by 25%, and ultimately creating a better experience for both the birthing parent, the family, and of course the newborn. Our bill to create the Community Doula Directory, which I proudly carried with my colleague, Assemblymember Szilagyi, is a major step forward in expanding access to doula care. It's going to help us better connect families with access to the doula care in their own communities. Nearly half of all births in New York are covered by Medicaid. The creation of this Community Doula Directory, along with the upcoming implementation of a Medicaid benefit for doula care, will undoubtedly make New York a safer place to give birth. But I do want to be clear about one thing. This is not where we stop. We remain committed to working with our colleagues in the state legislature, of course, our governor, Governor Hochul, but perhaps most importantly, those in our community who are most impacted by this crisis, the mothers, the families, and of course, our incredible doula advocates from all across New York State, to ensure that we finally reverse the deadly trends that we've seen for decades. Again, I'll close by saying thank you to Governor Hochul. You are making New York a safer place to give birth for Black women like me and for women all across New York State. And now it's my honor to introduce my colleague in the Assembly and the sponsor in the Assembly of this legislation, Assemblywoman Michaëlle Solage.
Greetings, friends, families, and most importantly, my sisters, my doula sisters, right? This is amazing. I'm just really excited because when I first came into office, someone said to me that if you have children, it's going to ruin your career. And I want this day to show that mothers can do it all because they have a village behind them, right? That when we have a woman governor, like Governor Hochul, we can get advances in our society. When we have great senators like Senator Baruch, a champion here who literally kept this beat drumming. Thank you, because you're sending a message to all women out there that public service is possible. And we know when women are in public service, we get things done, right? So, I mean, the prior two speakers said it all. So I first want to also thank Health Chair in the Assembly, Amy Paulin, who helped get this across the finish line. Thank you to her and all my colleagues who voted for this piece of legislation, because every woman deserves joy in birth. It's insane that today birthing is a business, and that we're not able to provide the tools that women need, the real tools that women need, like birth justice warriors out in Long Island, who help women know that they have support in birth, that they don't have to be alone. Like Ancient Song, who literally, when I first put in the doula bill, probably 5-6 years ago, brought me in a room, Chantel, and cornered me and said, hey, remember that doulas are a support system, a vital tool in the toolkit to ensure that women can have joy in birthing. And we see the statistics that Black women are 3 to 4 times more likely to die during childbirth. Not only mortality, but morbidity, that for the rest of their lives, they'll be affected because they weren't afforded joy in birth. But not here today. Today we are here to celebrate this wonderful piece of legislation, because communication is the key, as all the doulas here know. Communication is such a vital component to birthing. And so we are communicating to New Yorkers that there is a directory, that they will be able to go and find information. They don't need to go to TikTok or Snapchat or any other crazy social media or platform, but they can find accurate healthcare information for them. And that's exciting. Because we all have our stories, our experience in birthing. And for me, I've had 3 kids, and I myself have interacted with the medical system. And I see why it's so important that we need to expand doula coverage here in New York State. And not just regular doula coverage, but we need to make sure there's access to birth doulas, abortion doulas, doulas that deal with postpartum. We need to expand the gauntlet, because there are so many doulas that are here to help. And we also need to make sure we're building the pipeline so that women know that they can become doulas. They could do it on the side, like a side gig, or they can even do it themselves as a full-time profession. But today is a first step. Today is a first step in us saying to all New York women that we are here for you in New York State, that you can have that joy in birth, that you have a village behind you. You have a state behind you. So with that, I just want to thank the governor again for doing this. It's wonderful. I thank all my partners in government. I thank the doulas who've always been there and having conversations. Sometimes you're tense, doulas. I know. But you do it from love, and that's what we need here. We need love in birthing. So with that, I'd like to call up Shannon Johns, who is a great doula in New York State. Thank you.
Good afternoon, everybody. Thank you so much for coming together. I want to extend a huge thank you to Senator Hochul's office for inviting me to not only attend and participate, but also speak. So thank you for that. I also want to extend a huge thank you to Senator Baruch, because the amount of work, time, dedication, and commitment that you've put in to putting all this through, to making it known, to making people open up their eyes and be aware of our role and our job as doulas and say this is part of a solution. Thank you. I really, truly appreciate that. And I know that all of the doulas across the state also do appreciate your time, your effort, and your commitment to this work. I want to start with when the Erie County Doula Pilot Program first rolled out, there was like not a lot of interest in it. And the reimbursement rate wasn't really much. It didn't really, wasn't a sustainable rate. It wasn't anything that was going to make a huge difference in our income as doulas. However, for the service that we provided to the women that was on Medicaid, the women that needed the support, that needed the education, but also too that needed that guidance to say you have options around birth. You have choices. You have a decision you can make that's going to change the outcome for yourself, but also too for your baby. We did the work. We put the time in. We put the our effort in. We turned down some clients where we would have made a lot more money to take these moms that were on Medicaid because they needed the support. They needed the education. They needed us as doulas to give them that experience. They needed us to give them that confidence in their own ability to give birth, but also too, it changes the entire outcome for not only the mother, but the baby, and then their overall experience moving forward. So now when they have friends and family members that are pregnant and they say, well, I'm scared about this, I'm nervous about that, my provider is telling me this, they say, go take a childbirth education class. Go talk to a doula, hire a doula, get all of the tools that you need to create this ultimate birth experience for yourself. And that is what our role is as doulas, is to give them that guidance, that information, that confidence to keep them motivated so they do have a better overall experience, but also have better birth outcomes. So this way they go home with their babies. This way they actually go home. So having that doula support there is hugely important when that pilot program came about. One of the other things with doulas is that it now also creates a new career pathway for individuals that do want to be in that, in a sense, healthcare field, but don't have that desire to want to follow the medical pathway. So now here's another pathway that you can work in healthcare around pregnant women and with their babies. And for a lot of us as doulas, we also cross over as lactation consultants. So we also offer support and education to women that are planning to breastfeed or want to breastfeed or tried to breastfeed before and it didn't work. So now they took the steps to become that person that they were looking to become when it comes to breastfeeding beforehand. So with that, with doulas, everyone before me gave all the statistics, gave all the numbers. I don't need to repeat them. So that is what our job and our goal is to really kind of help enhance that experience, make sure moms and babies are going home, but also to really just change the entire trajectory of the lives of moms giving birth in New York State. New York State has taken a step that not very many states across the country has taken to make the change, to be dedicated to saying we are now going to change history with this bill signing. So thank you for that.
Please remain seated for the signing of the bill.
If you're taking a photo, please be kneeling. If you're taking a photo, you've got to be kneeling so the cameras in the back can see. Thank you.
unfolding in our courts this week. Today, just a few blocks from where we are, we're hoping that the truth comes out about a fraudster, an imposter, someone who allegedly lied about all his business holdings over an entire lifetime. Former President Donald Trump is testifying in an unprecedented civil trial brought by our own Attorney General Tish James. So far from telling the truth, as he's required to do, he's throwing temper tantrums from the witness stand and verbally attacking judges and courtroom staff. His conduct has been a disgrace, and I have full confidence that Donald Trump will be held accountable for his actions. There's another legal proceeding happening in Washington with the Supreme Court. They'll hear arguments tomorrow in the Rahimi case, which is a law that they're considering a law that prevents domestic abusers from getting their hands on guns and deadly weapons. Common sense to most of us, and the choice should be clear. The question is, will they stand up for common sense gun legislation that protects vulnerable women from abuse, or will they stand with the mega extremists and let abusers get their hands on guns and possibly kill women? As many of you know, this issue is personal to me. My late mother grew up in an abusive household. She dedicated her life to helping victims of domestic violence. But unfortunately, New Yorkers know that the Supreme Court has the capacity and the ability, and has done so, the ability to eviscerate our own gun laws here in our state. That's what happened in the Bruin case when they struck down the concealed carry laws that were put in place over 100 years ago that allow a governor to protect her citizens from people with concealed carry weapons, even in public places. Tomorrow we'll see whether the Supreme Court will have any kinds of limitations on that interpretation. We hope they do. We'll be watching it closely, as will millions of Americans and those particularly who are victims of domestic abuse. With that, I'll take a few questions.
Any on topic? Yes, Sonia.
Yeah, so much of the reporting that we've seen about the infant and maternal mortality rates mentions how women's physical and emotional discomfort is not always taken seriously, and that tends to be a big part of how these tragedies happen. How do you work on changing that culture?
What we did here today was to give access to another advocate to help women who understand them. These are doulas. These are trained professionals. And today, people don't know how to reach them. We are now establishing a directory. So anyone who's pregnant, finds out they're pregnant, the first call they should make, if they want to have a support system through the entire process, who will let people know what the patient is going through emotionally, but also when they get into the birthing room or the delivery room, that they have someone who can be an advocate, say, no, do we really need to have a C-section here? Or there's more pain medication needed, that they can actually speak up, because I've been there. Women are in no condition to stand up for themselves when they're going through childbirth. So a doula can help rectify the problem that you're talking about, is that there's no one listening to them when they're in this time of great distress, all the way up until the baby arrives. And that's why we're so focused on expanding doula care and making sure that Medicaid picks up the costs as well. So costs will no longer be a barrier for women who need extra help starting in January. So that's the good news that came out of today's press conference.
Kelly,
I have an off-topic question.
go for it.
Okay, Governor, I wanted to get your thoughts on what's going on with the mayor right now in regards to one of his top fundraisers being investigated by the FBI. Does that worry you that it's going to distract the mayor from the migrant crisis? He came back from Washington just for that. I wanted to get your thoughts on both those things.
I said from the very beginning, this state deserves to have a governor and a mayor who actually work together. We've been working very closely on the migrant crisis, on public safety, making sure that our subways have all the services they need. So we have been good partners. I've seen the reports. I've seen no coverage or reporting that says the mayor has been accused of any wrongdoing. And so we're going to continue working together. That's what New Yorkers expect, and that's what the New Yorkers will get.
It'll distract him from focusing on the migrant crisis? He came back from Washington rather quickly.
He has been laser focused on this. Our teams are embedded together. We have a lot of work to do, so I have full confidence that he will not be distracted. In fact, we're very much aware that he's on the job serving New Yorkers as we speak, so no concerns there at all.
Thanks, everybody. I gotta go.
All right, thank you. Appreciate everybody coming out.